Welcome everyone to our third Thursday Career Chats. Today we have Darryl Vaz, who's the president of Medicom Health, and he's going to be telling us about his career pathway and some questions he will field from our trainees that are in the audience. So without further ado, Darryl, take it away.
Awesome, thanks, Nana. So thanks everyone, and I know we have some late PhDs in the group here, some early masters. I'm hoping that my path will be able to give you some thoughts about how you translate all of that into a career path. I didn't go as far as the PhD, but I was almost there. So I'll chat a little bit about that. So it might help to give you a bit of background for how I got to where I am today. I'll start by saying where I am today, because I think it'll put it into context for you. So I am the president of Medicom Health. Medicom is a healthcare communications agency based in Guelph, Ontario. We if you don't know what the Healthcare Communications Agency is, I'll tell you, we are essentially an outsourced service for the pharma industry for aspects of the business where they're looking for more expertise. So whether it be medical writing, negotiating with certain regulatory bodies, sometimes it's software development, sometimes it's just the graphic design part of it. Think about an ad agency that services every other industry. The pharma industry needs very specific types of ad agencies who understand healthcare, because our audience is very different too. Our audience is healthcare professionals. So that's the expertise that we bring, and that's what we build in the people who we hire, and then why people keep coming back to us for business. So it's a bit of a niche industry. I would venture to say there's maybe 24 companies, really well-established companies in the country who do it. And if you want to talk about the ones who are at about our size or larger, you're probably at less than a dozen, maybe even less than half a dozen. So there's not a whole lot of companies who do what we do. It is very specialized, and as many of you might know, the pharma industry is quite small and concentrated in Canada, so you tend to know everyone. So how did I end up here? Because it feels like not long ago that I was exactly where you were in doing my master's degree and not quite sure where I was going, and didn't even know this whole industry existed. And here I am owning a company that is a decently sized player in the industry. So I will maybe go back to my undergrad, is where many of you might have been, where I thought I was going to go to med school, and decided at one point that that's not going to happen because maybe I didn't focus enough on grades and had a little bit too much fun. And so I decided to do my master's in science because I knew I needed to do more schooling beyond my undergrad. So my undergrad was in molecular biology, did a master's in medical science, and partway through that master's in medical science, I was lucky enough to have some great opportunity to apply for a scholarship to do my PhD. And I was actually fully funded to do my PhD with a grant out of the US to continue my research in breast cancer and identify molecular targets in breast cancer. And so it seemed like a great thing. Oh, I'm going to be a well-paid PhD student for the next 4 years. And I honestly don't know what really prompted me to think about it. And at the time I thought, oh, do a PhD, be a prof, sounds great. I love campus life. I love teaching. I love science, curiosity of it. It seemed like a good way to go. And something just clicked. I think it might have been grant writing. Didn't quite sit well with me. I didn't like kind of begging for money every year to get my research funded. But something said I wanted to do something different. And so I decided to turn down that scholarship, much to the chagrin of my supervisor, and close up my master's. And at that point, I knew I needed to enter industry if I wanted to get away from academia and research, because if you're going to stay in academia, you better get that PhD. And so I just started working with recruiters who work in the pharma industry and talking to people much like you are right now. And it was one fortuitous conversation with someone who basically told me about a recruiter who I hadn't heard about. I sent my resume to that recruiter and they called me about a job with an agency. He said, have you ever thought about working with an agency? I was like, what do you mean agency? Like CIA? It just sounded really, sort of suspicious. He's like, no, advertising. And I was like, what do I know about advertising? I've got 2 science degrees. Like, I've never taken a marketing or a business course. It's like, no, there's agencies who work in pharma who need people who know science, who can work in different therapeutic areas, quickly absorb them, develop content, work on the strategy of it. I'm like, sure, sounds great. Send my resume in. And I was lucky enough that it was a startup who decided they'd take a chance on someone who didn't know what an agency was 3 months before or a month before. And it was a very successful startup. So it was a company in Toronto where things went very well. I was the fourth person hired. And by the time I left there, about 6 years later, we were over 40 people. It was basically a learning experience like I've never had before. I learned more in those 6 years than I think I did my entire life before that. And I think what happened over those years is I learned how to apply my scientific knowledge and the basics of everything I'd taken from the fundamentals, so I could read a clinical trial paper and understand what it meant and decide what's important and what needs to go into a communication piece, and think about strategy about what do doctors need to know as they're deciding which drug they want to prescribe. These are the things that kind of come to you as you work more in it. But what I learned about myself was that as much as I could do all that scientific stuff, I kind of enjoyed the business side of it a little bit more. I enjoyed the strategy of, well, what is the right type of project to do? And how do we make that project successful? And how do we make that project profitable, for the agency that I was working for? And who do we need to hire in order to best service that? Because we went from 4 to 40 people. So the skill set of the type of people you want to bring in, it was a lot of fun figuring all of that out. And so I think it would have been about a year and a half, 2 years into it is when I started my MBA, because I knew right away I wanted to do something more business related eventually. And it took me about 4.5 years to do my MBA because I was doing it part-time. So that was through the rest of the time I was with that first company. And then right about the time that I was finishing the MBA, I got approached by a recruiter without asking them to come to me. So that's a nice thing. Once you've been in pharma for a little while, recruiters come to you because it is a very small industry. About whether I wanted to take over as managing director of another agency, and it was Medicom that was out here in Guelph. And it was, sort of a daunting thing to think about at the time, but it was right for me. And mostly I would say it was right for me because my wife's from Guelph. And so I said, oh, Guelph, who ever heard of a pharma, a company that works in pharma in Guelph? I can get rid of this 45-minute commute I have in from Milton every day. Let's move to Guelph. So that was now 12 years ago that I made that big jump and left what was a very successful agency at the time to come to a much smaller agency to take leadership of it. And now 12 years later, that much smaller agency has grown a lot. We are alone are closing in on 30 people. It's been a fun ride. I now have a strong group of, I think, a support team that allows me to be so far away, I would say, from that conversation of what content out of this clinical trial paper is important and how do we influence doctors. I don't necessarily get into that every day in my role as president, but I still have a lot of the fun in the strategy of which tactics are right, who do we need to service that, how do we make sure we're putting out the best work possible, what's the new service we're going to do that we've never done before that can really help our clients meet their needs. And their needs are evolving, and this last year and a half has taught us that more than ever, that their needs can change anytime, and as an agency we have to be able to adapt. So it's fun to be small and nimble and do that on a whim, create a new service or a new pillar or hire a new skill set you never had before. We can just do it, right? And so maybe I'll just mention finally, that's my path that has kind of led to this ownership role. So eventually I ended up buying out the past founder of Medicom. That's how I own it right now. And I would say that I've noticed over years is that we hire people with science degrees across the board. So everyone who comes in has a science degree, whether you're working on project management or medical writing or whatever it might be, because you just need to know the science, or that's a really hard obstacle to overcome in conversations with clients and doctors. If you don't get there's people who don't get what proteins and translation and RNA and all of that is, right? If you don't have any of that, understanding how drugs work can be pretty tricky. So that you need someone with that basic science, but then your personality kind of takes you two ways. And I think we see the people who just really love the science and the challenge of it and learning new therapeutic areas and talking about it we work with the leaders in every therapeutic area in Canada, which is I think, a privilege for us. So getting to talk about it with experts and debate things with them and hear their opinions. So there's people who are still all about the science, who love it. And every now and then that enthralls me, but that's not my everyday. And then there's the people, I think, who say, I'm glad I have the science because it gives me the key to this industry, but I really, enjoy kind of the business challenge of it more, and the people management and optimizing a business, and whether that be on an agency side or on our client side. So all pharma companies across the board, small and large, are our clients. And you see that on the client side too. You'll see people who are more in the medical departments, medical affairs, MSLs, who kind of gravitate more towards the science. And then you'll see the product managers, market access and reimbursement experts, people who take the science and then figure out how to meet business needs within the boundaries of science, if that makes sense. Because the evidence is the evidence. You can't make up anything, right? It's all got to be based on it. So that's what I've noticed over the years. And I think that's where all of you will, those of you who are in your masters, I don't know if you're thinking, I'm at this session because I got to figure out, do I want to get my PhD or not? Those who are in a PhD might be thinking, did I even do the right thing? Why did I get this PhD? Where am I going with this? But regardless, I see people at both levels who go down both those paths, either that, more scientific or perhaps business minded. I'm going to say doing things that you never even thought you'd do. I never thought I would do this when I was going to school and growing up. I thought, even if I'm not a doctor, I'm going to do something practical. I'll be a physiotherapist. I'll be a chiropractor. I'll work in a lab. I'll do something. I love science, and I still do. But I love that science has allowed me to do what I do right now, which is hire people, manage people, build a team, build a culture, service clients, make a profit at it, of course. But it's a whole different challenge that I never thought I'd be up for. So yeah, that's me in a nutshell.
Awesome.
Is that kind of what you're looking for, Nana?
Yeah, that's amazing. That's amazing. Thank you for sharing that. So I know I have tons of questions, but I'm going to see if there's any questions in the chat. That would be great if you can post your questions in the chat, and then I'll get to you as the questions come in. And then if you have the questions and I ask, you're going to be unmuted and you can ask your question directly. And I see Ashley typing away. So Ashley, why don't you just unmute yourself and ask your question?
Sure. My dinner was served while you were speaking.
Yes, multitasking.
That's right. I'm always curious to know, if you were going to do it all over again, or if you were going to, as your current self, if you were going to give your past self some advice when you were sort of at that decision point where you were trying to decide if you were going to go into the PhD or not. What would you do differently, or what advice would you give your past self?
So I just speak to students a lot because I always find I've been very lucky with how my career's gone, and I try and just pass on the good karma and help out wherever I can. So I do these types of talks a lot, and I get that question a lot. And I think it's easy for me to say, I don't have any regrets. I'm very happy with exactly how it went because it served me well. I would not have had that first position coming out of my with the startup agency if I didn't have a master's degree. If I tried to do that with a bachelor's degree, they wouldn't have taken a second look at me. If I had a PhD, maybe they would have looked at me even closer, but a master's was just enough to get noticed. And then the rest, of course, is in the interview process and kind of proving yourself. So I know I needed the master's. Glad I made that decision. And I didn't waste time, if you will, doing a PhD because, yeah, it may have made it easier to get in, but I managed to do it without it. And then deciding to do the MBA at the time too. I didn't know what job I was going to do with an MBA. It was just because. But I wouldn't have been recruited for this job to take over as a business leader of a company unless, at the time the founder said, oh, Darryl's doing an MBA. He clearly has a passion for the business side. Let's talk to him. Let's see if he's interested. So again, the MBA served that purpose for me. So I can look back and I think, luckily for me, say, I wouldn't tell myself to do anything any different. I guess the only thing I would, if I'm to think about other people going along the same path, is what if I got into the industry after that master's. I started with that startup, and then business wasn't for me. At some point, I might have said, oh man, if I'm going to stay in science and be a writer, or transition over to the client side with a pharma company and be in research or whatever, that master's is going to be limiting. And I should have really finished my PhD. So I'm lucky that I figured out that business is more for me. But if you think the science might be where you're really going to spend the rest of your career, then you get the PhD right at the start, because who's going to go back for it later? You're not, right? So get it right at the start.
Yeah, good advice, Darryl. And we chatted a little bit about this last time with Dr. Lee, and the regrets portion. I don't think anyone should have regrets, because you did the best you could with the information that you had under those circumstances. And I think if there's anything that I would have advised my younger self, is probably do some more informational interviews, seek out some more mentors. That would have been one advice that I would have given my younger self.
And I'll jump out on that with the question that just came in the chat. So Umama was asking
mentorship questions. You want to ask your question, Umama?
Yeah, sure. So exactly what you alluded to. I want to ask if you had a mentor during the time you were figuring your career out, and how important was networking to your success. And then another question I want to ask was, what were some of the biggest lessons you learned? Either someone told you, or something you learned throughout your educational career that really helped you succeed. Thank you.
So I'll echo Nana's comment of, maybe if I did have to look back at myself, I would have said network more. And again, this is why I say I feel I've been very lucky. I got to where I was not because I networked and I looked at every angle, and all things just happened. I worked hard, obviously, and I think I'm quite capable, and I got noticed, but things just happened to come my way. The right people called, and the right people I talked to happened to lead me in the right direction. But no, I never formally sought out mentorship, or was one of those people who just networked like crazy and added people to my LinkedIn profile LinkedIn, barely a thing, I think, back then. I don't even know when LinkedIn started. I don't think I had a LinkedIn profile back then. But so the answer is no, and it's possible, obviously, but I would echo Nana's statement. In this day and age, man, if you're not networking, you're losing out, because it's so easy with LinkedIn. It's like everyone's out there for the taking, right? Just do it in the right way, and people are going to help you out and talk to you. Your second question, that's a hard one. Biggest lessons I've learned or advice been given. I think more now about the advice that I give people. Maybe I don't remember the ones that came to me. So the biggest advice I give, and goes along the same lines, is there's something to be had from every single conversation. There's something to be benefited from every single conversation. So I look at it as, when someone approaches me one-on-one and asks for an informational interview, I'll take it. For example, they may not be someone who's going to work here or who we might hire, but they might enlighten me on a new program that some university has started that we want to start recruiting from, because we're looking for that kind of talent. And so then I tell my recruiters, that's where you need to start going. So when a supplier wants to sell us a new software, it happens often. And sometimes you'll talk, because maybe we don't need the software, but manually we can implement that kind of a process internally to better our process. So every conversation has a benefit, and of course it takes time, but you got to open it. You got to approach it all with that open mind, so that you can benefit from it.
Thank you. I also have one more follow-up question. What's one soft skill that you think is universally important in the pharma industry, or any industry?
Yeah, I'll say any industry. Yeah, I'll say any job other than the really technical jobs, where if you're a science genius, then you don't need any people skills, because you're going to be able to figure out things or an engineer or whatever it is, you can figure out things that no one else can figure out. But other than those people, I think the soft skill would be empathy. And I use that word in terms of not, showing compassion and as most people interpret it, but being able to read other people's emotions and understand where they're at. So if you're talking, it comes down to the interview process. If you're talking to someone and you can read that they are impressed with you, you're going to continue that interview in a certain way. If you can read that they're not that impressed with you, you're going to take a different approach and try and grab their attention now, right? With something different. If you're trying to sell them a service, it's the same thing. If you're trying to, whatever you're trying to achieve, I think having empathy and be able to read people's emotions quickly and adapt to it is a highly valuable skill in any job.
And can curiosity overtake some of the technical skills in the field, do you think?
Yeah, it's funny you say curiosity. So one of the things we do, and I'm sure you guys can go to Medicom's website and learn more about the very specific services we do. But one of the things we do is we run advisory boards, which are like focus groups with physicians, like market research, right? We got to figure out with a small group of physicians, how should we position this drug when it launches, or what do you want to see? And my role in many of those meetings is to moderate them. And so I do what feels like hundreds of those meetings a year. And they're all in different therapeutic areas, and they're all with the top doctors in the country, sometimes the world. And quite often my employees, my clients will say, how do you do it? How do you always seem like you know what's going on and you ask the right questions. And I am not a therapeutic area expert in all of that. I get a briefing from my medical department, but there's only so much my head can hold. So it doesn't all stay in there, but it's curiosity that drives me to say, well, okay, if they just said that, and the empathy, if I was in my client's shoes and they're on the meeting, what would they be thinking right now? What do they want to know? So I'm going to ask that question on their behalf because I'm curious and because I understand where my clients are coming from and how it impacts their strategy. So yeah, it can help. And curiosity, I guess, with the resourcefulness to find the solutions when you ask questions.
Thank you.
No problem.
Yeah, I second emotional intelligence.
Yeah.
I mean, emotional intelligence and your EQ. I just put a resource in the link for everyone. If you haven't heard of it, or you're just exploring it, the Harvard Business Review has wonderful articles and videos on what emotional intelligence is. And yes, ask any guest who comes, and they're going to say people skills and emotional intelligence for sure. EQ.
And you guys are lucky. I think this whole COVID thing has happened. You're already adults. You've already figured yourselves out a little bit. I'm worried about what it's going to do to people who are earlier in their lives. Adolescents, my kids who are young, I think it's a short time frame, and hopefully a long recovery will then make us forget it all, but it's having an impact on people's ability to deal with other people because they're just not used to talking with anyone outside of their family. And so it'll be interesting to see how it plays out.
There'll be crash courses on EQ when they get later on. Sarah, do you want to ask your question? You can unmute yourself.
Sure. I wanted to know how you made yourself stand out as the applicant when you were applying after your master's, especially since you're competing with folks who might have had a PhD and beyond.
Yeah. That's a great question. I don't know. You always think you're great. So you think, oh, of course, they saw who I am. So that's why they hired me. But yeah, clearly there would have been other great applicants. So maybe let me take a perspective of I've done more hiring in my life than interviewing. I've interviewed for 2 jobs in my life, and I've hired hundreds of people over the years. And so I think what allows people to stand out, and maybe how I was able to stand out, is the personal connection, right? It's forming a bond with the person. It's not that I'm going to tell them facts about the grades that I got or the research that I did or how many references were in my thesis and I researched it so well and I answered that question really well. They're not going to care about that. It's the bond you make with the person across the table or the people across the table from you. So I think there was a culture fit from that aspect, like me and the person who, and at the time it's 4 people, so it was the president of the company who was interviewing me. We just bonded, and we bonded at the point he was the MC at my wedding, 4 years later. So, we were friends. And so I think that is you can't fake that, right? You're authentic to who you are and you just kind of click with certain people and not. But I would say, the advice that I would take away from that, because obviously you can't just work with people you click with, you got to be chosen out of all interviews that you go for if you could. I kind of look at it now as when we meet clients and we're asking clients to do business with us, it's more than just, hey, we've been in business for 28 years and we have all these services and doctors know us and clearly we know what we're doing. Otherwise, we wouldn't be here for so long. That's a given, right? They should already know that. They're staring at us across the table and saying, do I want to work with you? Will I enjoy working with you? Do I trust you to do what you say you're going to do and, take care of my business like it was your own? And that's what you're trying to sort of put out there and show your commitment. So it's more than something that I had in my resume. It's hard to say.
Actually, there was a scientist who was hiring for her company, and the question she asked was, tell me something about yourself that's not on your resume.
Yeah.
So it's that humanity quality about yourself, right? And you should know how to answer that question, by the way, for all those that are going on interviews.
Yeah.
If someone asks you that question, or if they say, bring me your resume to life, what are you going to say? All the degrees and the classes you've taken, everyone else has that who's applying for this job. But what is that Sarah Park factor, right?
Yeah.
That you're bringing to our company that's not on your resume. That's like what Darryl is talking about, that human factor.
I played a little game with myself there, Nana, and I said, what would I have said if I had been asked that question when I was interviewing, 20 odd years ago? And I think my answer now, I say my answer would have been authentic. Back then, I probably would have been nervous as hell and probably not been brave enough to just give the truth. But right now, I would say the best thing I would say, and that I would love to hear from a candidate in the same position, is, I was all set to do my PhD. I had a scholarship all set up. I know that's not for me. I decided to quit and I came here. I want to get into this industry. I'm hungry. This is all I have right now in order to make something. You're starting something. I'm starting something. You're at a startup stage. I'm going to do whatever it takes for this position, right? And you've got my commitment. So that's what you would want to hear. That's authentic. It's not saying I think I'm the best writer or I've got the biggest network in the industry of people who know me or anything like that, right? It's human to human. Why would I hire you?
You're hired, Darryl. I would have hired you, but so if you can research that company and figure out, okay, how am I going to help them, right? And with your background, it's sort of like Darryl was saying, you're new, I'm new. How did he know the company was new? Because he knew about the company, right? Yeah. So just knowing that and knowing what they're building on, their mission, and how you share that, that's what you want to bring to the table. So actually, before we say goodbye to our people from home who are watching this, Darryl, if you can provide one piece of advice, and then we'll get to everyone else's questions with your cameras back on. Sure. If you can provide one piece of advice for the people at home that you haven't touched on already in about a minute or so before we close, that would be great.
So I think something we haven't talked about, or maybe I just touched on, is authenticity. And so people always, I did a whole session with an MBA group about preparing themselves for interviews and doing mock interviews, et cetera. And one of the things that kept coming back up again and again was authenticity. You have to know who you are, do the research, know who you're talking to across the table, and figure out the truly meaningful matches, right? You can't fake it. You can't oversell yourself. You are who you are. And I think what that takes is self-awareness. So you have to know truly what you're capable of and what's going to be a stretch for you. I knew that first job I got was going to be a stretch for me, but I gave them every confidence that I would step up and do it. I knew when I came to MediCom that it was going to be a stretch for me. I'd never led a company. I'd never made financial decisions for a company, but I was very authentic in the interview process. Now I had the founder with me to hold my hand through it. So it's not like I was being dumped on the job, and just said, go. But I think being authentic, being self-aware of who you are, and then being authentic with the person who you're talking to, interviewing with, whatever it might be, and then being creative enough to find the fit where those two come together so that it is an opportunity to take advantage of. Because you can never say, oh, well, I don't have that skill set, so I can't do the job. All right, I don't have that skill set, but I'm willing to learn. I know this person. I found this course. I'll get up to speed. Give me 6 months of someone who can, hold my hand through it, and I'll be okay. Come up with the solution. So be creative.
Awesome. Lovely words. Thank you, Darryl. So for those of you joining from home, thank you for tuning in, and join us next month where we're going to have Dr. Michael DiDonato and Dr. Grace DeSantis, who are from Scripps and Illumina, their husband and wife team. So they're joining us together. So we will see you then, and have fun.